Good morning. We're happy to join you again for our third update on what's happening relative to COVID here at Children's Hospital. Last week we talked a little bit about capacity, talking about what's going on in the ambulatory outpatient environment. We'll revisit that again today. We also touched on what's happening inside the hospital with admitting patients. And then the last few things we touched on is what we're doing to respond to the volume. You heard about additional coverage in the ER. You heard about the testing center that was operating, that continues to operate Monday through Friday, 10 a.m. to 6 p.m. And then finally, we talked about monoclonal antibodies, which we will revisit today. So as we get started, let me just touch briefly on what is happening in our ambulatory environment before I bring Dr. Childs into the conversation. We continue to be extremely busy in the outpatient environment. And when we talk about the outpatient environment, specifically we're talking about the emergency room volume, the urgent care locations across the region, as well as what we're seeing in our primary care volumes as well. And while those are higher than we would have normally at this time of year, they're a little bit lower this week than they were the previous week. We were averaging about 200 patients a day the previous week. This past week, about 175 patients a day. The urgent care environment's also down about 15% where they were, and then our pediatric primary care office is down about 9%. Now, obviously not all of those visits are related to COVID, but they do give you an idea of what illness is in the community, and we're happy to see those volumes coming down, especially as we've had longer than normal wait times for many patients who are seeking our care in the ER and urgent care environments. So with that, I want to bring Dr. Childs in. We've talked a lot about testing and specifically what our positivity rate is for COVID-19 patients. What's that look like this past 7 days versus where it's been previously?
Well, we consistently saw testing rates about over 20%, which is really high. It has come down a little. We're thinking now trending 17, 18%. That's better. It's still a lot of COVID is in our community.
And we're also seeing higher inpatient volumes this week, which will be reflected on our dashboard tomorrow. Talk about what those volumes are and maybe some of the trends that we're seeing in those inpatients who are needing care in the hospital.
Sure. Our inpatient volume has definitely gone up. We've had over 20 admissions in the last week, and we have 15 patients right now in the hospital. Most of these are teenagers, and as the disease progresses over a period of days, sometimes, especially if you're at risk to have a rougher time with this virus, it can lead to the need for hospitalization. It can lead to the need for you to be in intensive care. And sometimes it leads, sadly for us, to need to take over your breathing, at least temporarily, to get you through this illness.
So when we talk about inpatient hospitalization, we talk about it as a trailing metric to the disease, right? So you become contracted with COVID-19, and as the disease progresses, we spend a lot of time as a hospital, and many of our peers here in East Tennessee on the adult side have as well, trying to keep patients out of the hospital when they have a confirmed COVID case, and that's been through infusion monoclonal antibody. Let's revisit that. We talked about it last week. How many have we done? What have we seen as the results? What's our capacity? And if you're a mom or dad and your child has contracted COVID, what should you be doing to determine if you're eligible for a monoclonal antibody infusion?
Sure. Well, I mentioned the age of the patients that we've admitted here, and once you reach the age of 12 and beyond, you're eligible for monoclonal antibodies. These are antibodies specific against COVID and specific against the Delta variant. What that does is it adds to what your body is doing to fight the infection. And the FDA has released those for patients that have risk factors. The number one risk factor that we see is based on your body mass, on your weight. Significantly overweight teenagers are at high risk for this to be a very serious infection. Also, if you have heart, lung, and some neurologic problems, you also are a candidate to receive this. The earlier you get it in the illness, the better. And we have done right at 100 of these so far. Our capacity is really going to be based on how many requests we get, because if there are high-risk kids out there that need them, we want to make sure that they have the opportunity to get them with us or with another provider. But we think this can be very important at preventing hospitalizations. In fact, out of those 100 high risk, only one has had to come in the hospital. And they've done okay, but they did get sick enough and they got it late in the course that they needed to be in the hospital. It's very effective, and I think the big message today is we really want to promote this as a safe option to really keep kids, especially teenagers, from getting sick to the point that they need a lot of help at the hospital.
Yeah, it's been a great addition to the therapeutic regimen to try to keep kids well and out of the hospital. You know, it's what we do every day. We try to keep healthy children healthy, and when we have illness, try to bring about healing in that process. What you didn't mention in that 100 or so, or in our hospitalizations, which have been disproportionately teenagers of late, how many of those patients have been fully vaccinated at the point of admission?
We have yet to admit a vaccinated patient to the hospital. Everyone has been non-vaccinated in those 12 and ups that were eligible to receive the vaccine. But there's fear out there, a misunderstanding, I think, about the vaccine. There's also some misunderstanding and fear about monoclonal antibodies, which can be tragic in that these are safe and effective things. This virus is burning through the community, and the situation in the adult institutions is dire right now. They are overwhelmed with COVID patients right now. We still have capacity, but we do not like that we have 15 sick kids here, 4 in intensive care right now, with so much that can be done to prevent this. I hope that this changes in terms of comfort of the community.
So early on in the pandemic, we had a lot of conversations about the 5 core actions that were about things you and I, the community members, could do to help ensure that we and those around us stay healthy. Monoclonal antibodies is almost a 6th in this case, right? When you contract the virus, it's an additional layer of therapy that can assist to a high-risk patient and ultimately keep them from being another patient who's admitted for inpatient care.
Yeah, I would say those 5 core actions are really important, especially before vaccine. They're still important, but the critical way we get out of this is through immunity. And immunity can come through vaccination. It's very effective. Immunity also can come from having it, which is a much more frightening way to acquire immunity. So I think there are really 7 core actions, really, with 6 being vaccination and 7th being if you get sick with COVID and you're at high risk, is to discuss with your provider monoclonal antibodies. We can get that referral from your provider, and we can do that hopefully within a day or 2, get you scheduled in here to get the infusion. If you get it in the first 10 days of illness, it has a great chance of being very effective for you. It's an IV infusion, but it's really simple. It takes about 20 minutes to infuse. We watch you for an hour afterwards, and you get to go home and hopefully feel comfortable. And in fact, a lot of people will say they feel better within a day of getting that.
So Dr. Childs, we've talked about the number of patients in the hospital today. We've talked about risk factors. Talk a little bit about the 12 and younger population and what we're seeing relative to that population who can't get a vaccine and who aren't eligible for monoclonal antibodies.
Well, it's still true, Matt, that COVID for that age range does not produce near as severe disease. It's typically mild. We have had a few younger kids that have had to come in the hospital, but healthy kids that are under the age of 12 seem to handle this very well, and that still is the case in what we're seeing having to come in the hospital.
You know, it's great news that it's continued to be that way. It's another good reminder that if you're watching as an adult, as a parent, as a grandparent, and you haven't been vaccinated, you just heard Dr. Childs say that under 12 could certainly carry the disease, and they likely and have done well thus far when they are otherwise healthy. But if you're at home and you're with them and you haven't been vaccinated, then you're more at risk because of that. Is that a fair statement?
It is. One important step to protect those who can't be vaccinated is to make sure all the adults around them are.
So I think it's a good opportunity to once again thank our team here at Children's for being nimble as more requests come in for monoclonal antibody infusions, being able to do 10 a day, more than 100 as Dr. Childs talked about a few minutes earlier. And we're going to continue to do that as there are providers who have orders for patients who are at high risk to keep patients from being here at Children's Hospital. We don't want anyone to ever have to be here at Children's, and this is another way that we can play offense to play defense against the virus, something that you heard us talk about a few weeks ago. So as we conclude our remarks today, I want to shift gears a little bit and help us as a community think about the things that are going on around us. Certainly the COVID pandemic is still with us, thus the video you're seeing today and the message that we're wanting to give to you, but there's so many other things that are going on around us. About a year ago, I had the opportunity to move here to East Tennessee Children's Hospital, spending the previous 3 years at Children's Hospital in New Orleans, the only freestanding children's hospital in the entire state of Louisiana. And we're now 10 days post the landfall of Hurricane Ida. And while we're struggling with the pandemic, trying to keep each other safe, trying to make sure that our children are secure, there are some of my colleagues, there are patients and families who 10 days out don't have electricity, they don't have water, they don't have the ability to go and get gasoline, the ability to go and get simple things at the grocery market. So what I would ask of you, if you're feeling a need to jump in and help your fellow man, if you're feeling a need to be able to do something good and give a little bit of hope inside a situation here, both locally and across the nation, that feels a little heavy, I'd invite you to go to chnola.org, chnola.org. There's a Donate Now button that goes to the Employee Crisis Fund, folks who give their life caring for the patients there in New Orleans. And give them a little shot in the arm, just like the vaccine is a shot in the arm to be able to help with sickness as it relates to COVID. Be able to extend a little bit of kindness, a little bit of humanity, and make sure that those folks know that we're with them. You know, one of the special things about children's hospitals is we're a small community, and we have the opportunity to be able to help them in this process. So if you feel moved, we'd certainly appreciate you doing that. On behalf of Dr. Childs, myself, the entire team here at East Tennessee Children's Hospital, thank you for continuing to trust us. As we go through the pandemic and as we get on the other side of the pandemic, we're always going to be here to take care of you, and we're privileged to be able to do that. Have a great day.